Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle. Wherever you are and however you might be listening to me today, thank you so much for taking the time. And folks, we are back with another episode. Welcome to 248. That's what episode number we're on, 248. And folks, we've been off for about a month here almost. It's actually been almost an exact 30 days since we actually brought you our last episode. And I wanted to just, first and foremost, just tell you folks that I apologize for taking such a hiatus. We've been so busy here at our office. I've said it before and I'll say it again. It might seem like it because no one brings you more consistent content in a podcast forum than we do, than my organization. But we're not a radio station. We really aren't. You know, first and foremost, we're an insurance agency. And things have just been incredibly busy here in our office, but we're back. I intend to keep our schedule as consistent as possible, and that schedule is every single Monday. We bring you a podcast episode where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Today, folks, what I wanted to talk to you about was Medicare supplements. And in my opinion, how a Medicare supplement very much is an asset. It should be looked at as an asset. I've said this before, but I really wanted to kind of go into a little bit more of intimate detail on it. Let me start with this on this topic. There are a tremendous amount of people out there that communicate information about Medicare, and it's very clearly obvious when you listen to these people talk that they have very distinct biases towards either Medicare supplement programs, or also known as the Medigap, or they're incredibly biased towards the Medicare Advantage. And whichever way they lean so far that way, and they just completely trash on the other side. I don't want to make this political or anything like that, but it's almost like an incredibly political person. We all have these people in our lives to where they tremendously lean in one direction, left or right. And anything that happens on the other side is just, it's the end of the world. You know, it's 9/11. It's the apocalypse. The other side is trying to kill us or destroy us. And I'm not trying to make this political or anything like that, but that is how a lot of people do think when they get very, very, very political. And there are certain people that go the same direction about Medicare plans. And I hear it on both sides. You know, I hear it on the Medicare Advantage side. I hear it on the Medicare supplement side. I try to remain very, very center with you folks because I'm not so naive to think that there isn't a situation to where either side is going to be proper or best for somebody. You know, I've had videos sent to me as of late, you know, where there's people that have become internet sensations and they're nurses, and they're just completely damning Medicare Advantage plans, saying that they always decline tests that are medically necessary and blah, 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 blah. Baloney! Baloney! Malarkey! Bullshit! I mean, this is a person that doesn't have an insurance license. This is a person that is a nurse. You know, I just hear all of these biases towards different things from uncredible sources. I work with a litany of people on Medicare Advantage plan and a litany of people on Medicare supplement plans. I can be the first to tell you, anytime something's been denied, it's because the insurance company didn't get enough information from the provider. And once the provider provides that information, it's typically not a problem. Sorry to say, sorry to burst your bubble. I mean, you really think the Medicare Advantage program would be as big as it is if they didn't pay for anything and they just completely denied all services for no reason whatsoever, and the doctors are fighting it. The doctors are sending in information, and they just can't get them to budge. Like, give me a break. It's fantasy. It doesn't happen. I can't think of one instance, to be honest with you folks, where an insurance company should have paid for a claim according to their benefits, and they didn't if they got all the medical information. It's almost always the provider's fault. I'm sorry to say that and throw them under the bus, but my office works with providers and billing departments every single week because we help our clients with claims when they run into them. And guess what, folks? Usually the billing department is sending claims to an old insurance. Oh, they're sending a claim to an insurance company that isn't even active anymore with this person. Well, no wonder they're not paying the claims. They're sending them to the wrong billing address. They're getting the member number or member ID identification number wrong by 1 or 2 digits. Like, those are 99% of billing issues right there. Easily avoidable. But with me and kind of what I teach, people really can't get a feel for which way I lean. They cannot determine whether we lean more Medicare Supplement or Medicare Advantage. And that's because you can't get a feel for it because we don't lean any which way. We very much believe that both sides have their strengths and weaknesses. So take all of this into account when I'm talking about this episode. But I wanted to kind of give the Medicare Supplement plans their flowers a little bit on this episode, which I've done before, and talk about kind of the characteristics that they have that makes them, in my opinion, an asset for a person. So first things first, let's actually dissect what a Medicare Supplement plan is. A Medicare Supplement plan is, truly a secondary insurance plan, and a secondary insurance plan, for that matter, that pays after Medicare. So Medicare pays first. Medicare Parts A and B, provided to you from the federal government when you turn 65, provide you 80% of medical coverage. They will pay for hospitalizations. They'll pay for surgeries, doctor's appointments, durable medical equipment, skilled nursing facilities, rehabilitation, and on, medical bills. But they don't cover 100% of those medical bills. They typically are going to cover about 80% of those medical bills, and then they're going to leave 20% behind for you, the consumer, to pay. So, what that means is you have 20% to pay if all you had was Medicare. Now, Medicare on its own is not going to cover things like dental, vision, hearing, prescription drug coverage. So, when you go with a Medicare Supplement plan, it's a secondary insurance that comes through and pays the 20% that Medicare leaves behind. Depending on the company and depending on the plan you pick up, you could potentially have full medical coverage. We talked about the different plans in extreme detail in this episode. I'm not going to get into it today. Just go back and listen to some of the other episodes if you want to know about the plan Gs, the Fs, the Ns, and so on and so forth. And then you have to pick up your drug coverage separately. You have to pick up your dental, vision, hearing coverage separately. That's probably the negative side of a Medicare Supplement plan, is that all the different parts are interchangeable. You have to pick up really a different policy for every different area of coverage you're looking to get. Whereas if you go with Medicare Advantage plan, it's typically going to be all wrapped into one neat little package. But what you get on a supplement plan that you don't get on a Medicare Advantage plan is open access network. As long as the doctor or hospital accepts Medicare first, nowadays 98 to 99% of doctors nationwide accept original Medicare. So as long as they accept that, they will also accept your supplement regardless of which insurance company you pick up. Now, anytime you've ever heard of a network issue with anybody, it's been because they've had a Medicare Advantage plan. Medicare Advantage plans are different. They are built for certain areas, certain service areas, certain states. And typically, if you try to go outside of that network, that plan's network, it's going to be a problem. Some plans have great big networks. Some plans have itsy bitsy tiny networks. So it's a bit of a difficulty. Now, that being said, I would say that Medicare supplements are a great asset because you don't have to stay within a network. and it works the same in all 50 states as it does in your home state. It's not bound by state lines. If you move to another state, you can take your supplement plan with you. It's actually a very, very valuable commodity in that sense. Also, the medical coverage is as close to full coverage as you're going to find. But what else? Well, this is, in my opinion, the aspect of it that makes it incredibly valuable. Medicare supplement plans are what's known as guaranteed renewable. What does guaranteed renewable mean? Guaranteed renewable, simply put, folks, means that the supplement insurance company that you have does not have the ability to cancel your plan, no matter what. No matter how many claims you rack up, no matter what the case might be. The only exception to this, as long as you pay your premium. So make sure to pay your premium. They can cancel you for non-payment of premium, of course. But outside of that, they do not have the ability to terminate you. This is a fact. No matter what happens in the Medicare world, they are required to cover you because they're guaranteed renewable. This matters because Medicare Advantage plans, now while they can't cancel individual people, they can't just pick somebody at random and say, we're going to terminate your plan, but they do have the ability to exit markets. For example, you might have a Medicare Advantage plan in your market. Any given year, the insurance company that offers that program has the ability to pull out of that county and cancel everybody in that area. This is what you need to know. Typically, you'll see it coming. It's not going to be just like that, and all of a sudden you have no coverage. You'll have months of notice, but it can still happen. That'll never happen with a Medicare supplement. Guaranteed renewable. The other thing that makes this valuable is typically for Medicare supplement plans, in order to get on one, you have to be able to pass a certain amount of health questions and underwriting in most situations. So that means if your health does not allow you to pass health questions and underwriting on a Medicare supplement plan, you typically are not going to be able to get one, or if you are able to get one, it might be at a much higher price. The exceptions to this are if you're turning 65 and getting onto Medicare for the first time, or getting on Medicare for the first time, I should say, you are going to be able to get any Medicare supplement plan you want, no health questions, no underwriting. But let's say you're beyond that. Let's say you've been on Medicare for 5 years and you're on a Medicare supplement plan or on a Medicare Advantage plan. Your health goes south, you get cancer, you get put on dialysis, something chronic happens, something extreme happens to you. The Medicare supplement plan does not have to take you if you cannot pass the health questions. And there are very, very few exceptions out there for this rule in most situations. This is important because if you pick up a supplement plan when you're able to and you keep it, if your health goes south, you're going to have it. It's going to be there for you, guaranteed renewable. That is the beauty of programs that are guaranteed renewable. This is what they're not telling you out there. This is the things that you need to know. Not to say that Medicare supplements are perfect, not to say that Medicare supplements do not have their downfalls, because they certainly do. But they are, without a shadow of a doubt, very, very valuable commodities and assets. Anyway, folks, I hope you enjoyed this episode. I hope you enjoyed this show. Just wanted to kind of quickly bring you this message and talk about Medicare supplements and why they are as valuable as they are. We'll be bringing you episodes, many, many more going forward, especially with some updates as they become available to us about some changes for next year. We'll share them as soon as we're able to and as soon as we know things. As always, folks, if you are in one of the many, many states now that we work with people in on their Medicare health plan, we would love the opportunity to be able to talk with you. A list of our states can be found down in the description on the YouTube video on this video, or they're also listed in the show notes of this podcast episode. So feel free to reach out to us if you'd like to talk with us about your Medicare plan. No cost, no obligation, but our office number is 801-255-5340, 801-255-5340. And folks, I really hope that you had a great 4th of July. Hope you had a great holiday weekend. Hope this video finds you doing well. This podcast finds you doing well. And we'll be back with more episodes going forward. Here's to all of you having a fantastic week. Thank you so much for listening. We can't thank you enough. It's flattering that anybody take the time to listen to me flap my jaw. And we'll see you next time, folks. Have a fantastic rest of your week.